Hello, hello, everybody. I'm sort of jealous of you guys that you get to be in your PJs with your camera off. The boys said, "Why are you dressed like that?" Anyway, I'm going to give it just a few more minutes for people to hop on, but I want to be respectful of our time. I know that the time after the kids go to bed is valuable. So I'm excited to see some of you guys popping in. I always like talking to you and not talking to myself. So if you're here live, drop in the chat, tell me where you're watching from. I would be curious to see who all is here. And before we start talking about everything, I'd love just to kind of hear, what are you struggling with right now? Is it weight loss? Is it anxiety, hormones, fatigue? Like, what is your biggest, like, if you could change anything right now, what would it be? Hi, Ashley. So Ashley is my right-hand woman. Kathy, sitting in dining room office. Awesome. Ashley's my right-hand woman. So you're going to see her in the chat if you have any questions as we go. And then if you decide that you want to get plugged in, she is your girl. So she will help us with all of that. So who else is here? Brittany is here. Nicole, Lindsay, Sarah, Zoom user. I'm not sure who that is, but so just to kind of give you an idea of what we're going to do, I have just some slides as far as a presentation that I've put together that will go through what DNAcore is and why is it something that we should even care about. And then I'm going to kind of walk you through, like I would a patient, an actual DNAcore report. Now, the report is a 62-page report, so it takes time to go through, which we may not have time for all of that tonight, but I definitely want to point out some of the biggest things that I, like as a practitioner, look at, and some of the things that I think are most valuable. So, all right, let me share my screen here and we'll get started. If you have any questions as we go, you can drop them in the chat, and I'll try to save some time at the end for some Q&A. So we'll go through that. Oh no, something went wrong. Try again. Okay, let's try. All right, hold on a second. Let me refresh this. This is where Ashley has to help me. Okay, hold on. Got it. I figured it out on my own. She's going to be so proud. Okay, it says I am screen sharing. Can you guys see this? Is that up and good?
Yes, we see it.
Okay, awesome. Perfect. Okay, so DNAcore. Let me first tell you guys a little bit about who I am. I think most of you know, but I am Emmy. I am a family nurse practitioner. So I worked in the clinic for 12 years. And I saw did a lot of women's health. And one of the biggest things that women wanted to talk about with every appointment is weight loss. And I'm like, okay, there's got to be a way I can help people lose weight, but I know that the clinic is not the right setting. You know, when you have a patient every 15 minutes and insurance is dictating everything that you can do, like that was not the optimal environment. Also was kind of discouraging just how much control insurance had, gained over what medicines I had to put people on, what lab tests they would cover. So I decided to go out on my own and explore the functional side of things, which I was very skeptical of for a long time. Like if someone came in and asked me about supplements and stuff like that, I was just like, whatever, I don't, but my eyes have been just so opened as I've trained with some of the best conventional medicine doctors in the world, who were or functional medicine doctors who were conventional medicine doctors and now have gone into functional medicine. So You'll hear me say a lot on social media and that sort of thing that I truly believe that a combination of the two is where optimal health is. I don't think it's only medications or only alternative therapies. I think that if we could sit down and find a happy medium, that is the recipe for success. I am married to Steven. We've been married for 12 years this year, and I have 3 boys. So if there's anything I understand, it is the craziness of life. So one of the things I make sure of with all of my programs is that it's doable. And if I can do it, I promise you that you can do it. These are some things here that I'm passionate about, but basically that's kind of how I got it to where I am. So DNAcore, let me move my thing here. DNAcore is a genetic test. It gives us insight into there's 4 key areas that we're going to look at with DNAcore. So we look at nutrition, we look at weight management, we look at your response to exercise, and a big broad category that is my favorite part of the report, biological processes. And really it's looking at that. What that means is that it's genes involved in key biochemical processes, and that really governs a lot of health and disease. So those are things like oxidative stress, inflammation, antioxidants. And so we're going to look at all that in just a minute in the actual report. So doing this test allows me to personalize a nutrition, lifestyle, and supplement recommendation for what we call personalized health. So this is not identifying disease or treating specific disease. It's really about looking at your genetic makeup and coming up with a plan specifically for you. Okay, so let's talk a little bit about just kind of the world of personalized medicine. It's really cutting edge, it's science-based. We look upstream to find the root cause of disease, and it's tailored to the individual. So this is something that, I kind of use the analogy of taking out the trash versus spraying Lysol. So sometimes medications or the conventional, treatment is like spraying Lysol on a trash can. And unless we take out the trash and really get to the root cause, you don't necessarily get any better. Maybe you go back to the doctor, you have to take more medicine. But a lot of times we have to do both, we have to actually take out the trash and spray Lysol, and doing both is absolutely fine. But the point here is that it is not disease detection, it is tailored to the individual. So nutrigenetics is a big word, but it's really the science and the study of how food affects your genes and how your genes affect the way that your body responds to food. So one of the biggest things that I would hear with the women that came into the clinic is, I want to lose weight. Should I do keto? Should I do intermittent fasting? And the truth was, like, I was kind of like, well, I've seen it work for some people, but then I've seen it not work for other people. And that's true. So looking at nutrigenetics will tell us specifically how your body will best respond when it comes to all of these areas. And then nutrigenomics is just how the environment will affect the gene expression, whether it's positive or negative, favorable or unfavorable. So we're never changing a genetic code. We are looking at specific genes and how the environment can modify the way they express. So let's look just briefly at kind of the traditional healthcare costs. So obviously here in the United States, our healthcare costs are gigantic. I thought it was interesting that 4 in 10 US adults have 2 or more chronic conditions. And 47% of the total cost of chronic disease is related to obesity. So if we can use genetics to help people know what is going to work for them and how to help them lose weight, if we can identify genetic predisposition to things like cancer and anxiety and heart disease, and we can optimize that environment, obviously we can cut down on some of these costs. So this figure right here, the $11,201, that's per person per year for these diseases related to any sort of chronic disease, and especially obesity. So this is the DNAcore breakdown. I love the little wheel here that they give us. So like I said, we're going to look at nutrition, weight management, exercise response, and biological processes. So I am going to pull up an actual DNAcore report. Okay, I think that is up there. Okay, so this is a patient that I have worked with, and I have just deleted or covered up the name, but we're going to go through this just like I would with a patient. So this is, like I said, a 62-page report. It is very thorough. I love the report though because it's very user friendly. So you could read through this and gain a lot of information, but I walk through this with everyone, and we usually do it more than one time. I mean, this is something that we have to, continue to revisit. So this page just kind of goes over the science behind DNAcore. So we're looking at normal genes and then specific variations of those genes. It's important to note here that we're not looking for things like BRCA genes or specific cancer genes that you would have to do a lot as far as significant intervention to change the outcome of that gene. This is looking all at genes that can be not changed, but affected by nutrition and lifestyle. So I just want to make, it's not like we're going to get a report and find all these, it's not meant to be looked at as like good or bad. So I highlighted this right here because I love this right here. Knowledge of the genetic variations you carry can help you determine which diet, lifestyle interventions, and nutrients that you need to optimize your health. So we're looking at the genes, specific nutritional supplements, diet, and exercise, and that helps us lead you in the way of optimal health. So here's that little picture again. Another thing that I would note, just like I mentioned, that the variations are not good or bad. They just give us insight into how we can better support gene expression for optimal cellular functioning. Okay, so this gets into the meat of things, and I just want to kind of orient you to the report and then we'll break it down. But so anything that is grayed out means that you're at typical risk for, and anything that is bold means that you are at elevated risk for. Now, all the things that are bold, that doesn't mean that all of them are high priority areas. The way I approach this with patients is I go through the report and I give them 3 high priority areas that I want us to work on, as well as interventions. So first, I'm just going to kind of show you what it shows us, and then we'll get into, okay, well, what do we do about this? So for this patient, you'll see lipid metabolism. This is under the biological processes, which is probably the most overwhelming and confusing, and it just jumps right off with that. So this patient is at typical risk for high triglycerides, typical risk for dyslipidemia, which is, the good and bad cholesterol. I will say that this is not a real-time lab. Remember that this is a genetic test. So that doesn't mean that this person is never going to have high cholesterol, but if they do, there's not a genetic link to that, if that makes sense. But you will see that they have an elevated risk for lipid oxidation. So sometimes we get really hyper-focused on the numbers on paper. So when we see a lipid profile, we're saying, oh, your total cholesterol is high, your bad cholesterol is high, you need to start a statin. But one of the biggest predictors of heart disease is what's actually happening in the vessel, and that doesn't always have as much to do with what's on paper. So lipid oxidation is when there is inflammation and damage to the blood vessel wall, and that stems from an altered antioxidant enzyme activity. And you're going to see in just a minute that this patient has decreased function of antioxidant enzymes, which is where that's coming from. So this changes my recommendations than if we were dealing with one of these two. Elevated risk for type 2 diabetes. So with this, I would always look at the patient sitting in front of me. If they are maintaining a healthy weight, they're getting regular exercise, they're eating well, this should never really come to fruition in their lifetime. But if I'm looking at someone who is overweight and not exercising, and we have a lot of room for improvement nutrition-wise, that's definitely something that would be a higher priority area. Methylation, I'm sure a lot of you have heard me talk a lot about methylation. I'm very passionate about this because there are so many people who have altered methylation and they're not treated appropriately and they have a lot of symptoms. So methylation affects heart, mental health, mood, reproduction, blood pressure. It's one of those things that's happening in your body that you really have no idea, but it is extremely important. And we're going to look at just a minute at the recommendations, but one of the key factors in the methylation cycle are B vitamins and folate. So we'll talk about that more in just a minute. Oxidative stress, we look at oxidative stress and the function of antioxidant enzymes. So oxidative stress is something that we don't have control over. It's something that is always occurring. Even respiration creates oxidative stress, but we rely on antioxidant enzymes to neutralize that oxidative damage. So if we're dealing with someone who does not have great functioning of the antioxidant enzymes, your oxidative stress is not neutralized like we want it to be, and that increases the risk of cell damage, premature aging, and that's where we get some cancer concern as well. So I would say methylation, very important for heart and mental health, and then oxidative stress, detoxification, and inflammation. This is like a cancer section. So if you have a family history of cancer or a personal history of cancer, looking at these things gives us a lot of insight into how you can best be supported. As far as detoxification, we look at both phases, phase 1 and phase 2, and these both happen in the liver. So I describe this as a clawfoot tub. Phase 1 is how fast your water is turned on, and phase 2 is the drain. So I don't want to say the worst combination, but concerning combination is if there's accelerated function of phase 1 enzymes, which means the water's on really high, fast, and if there's reduced function of phase 2, meaning the drain is not draining correctly. That is obviously a recipe for not a great situation. So this patient in particular has accelerated function of phase 1 detoxification enzymes. So we'll talk in just a minute about, okay, what does that mean and what do I do to reduce that risk? But sometimes you'll see this be normal and this be decreased. And I'm going to show you some of the actual genes in just a second too, but this is one of my favorite parts of the report. And then we look at inflammation and elevated risk for chronic inflammation. Remember that inflammation is normal. It is a healthy response to any sort of like inflammatory stimuli. We rely on our body's inflammatory processes to fight off colds and flus and heal from injuries. But what happens is a lot of times we get that chronic low-grade inflammation, and that is what we don't want. We know that that is linked to a lot of cancers. It negatively impacts heart, mental health, weight, and that sort of thing. And then bone and joint health, we look at that. This patient does not have any increased risk, but I see this often on the reports that is an issue. And so we want to make sure that when we're looking at that we have them on optimal vitamin D and calcium replacement. All right, so moving on to nutrient requirements. This is one of my favorite parts because when I work with clients, one of the big things I teach them is macronutrients, and it's one of my favorite techniques to help people lose weight and keep it off. I'm spilling my water all over me. So this looks at specific macronutrient requirements. So I can guess, if I don't do this test on somebody, I can guess where they should be as far as carbs, fat, and protein, but this takes the guesswork out for me. So a lot of times we'll see that carbs are a significant barrier to them losing weight. But a lot of people who think it's carbs and have done things like keto and not had success, it's actually the saturated fats that affect them more significantly. So you can see with this patient, they have enhanced benefit for weight management when they're eating polyunsaturated fats. These are going to be things like flaxseed, walnuts, fatty fish. So the more we have them eating those sorts of foods, the better benefit and the more likely they are to lose weight than if they're eating like the saturated fats or the monounsaturated fats. And then enhanced benefit for weight management when eating good quality protein foods. So this helps me give you specific goals as far as what your body is going to respond best to just from a macronutrient standpoint. And then we look at micronutrients. So a lot of this is going to go back to those biological processes. So all of the B vitamins, that is what I mentioned is really important in the methylation cycle. The problem is that most people are taking the wrong form of that vitamin. They're taking cyanocobalamin or other preparations that if you have trouble with melanation, you need methylfolate, methylcobalamin, because your body really can't convert that vitamin into actually like a usable source. So that's very important. We look at B12, choline, vitamin C, vitamin D, calcium. So this patient does need extra vitamin D and calcium. So that really helps me tailor specific supplements, supplement recommendations. I know a lot of people when we start working together that have, like read that a supplement is helpful, or I don't know, I'm sure a lot of you have like, this sounds good. Should I take it? Should I not? This tells us exactly what do you need and what is just making your urine very expensive because you're just peeing it all out. So, and then we look at food intolerance and sensitivity. So we look at lactose tolerance, we look at celiac, and this doesn't necessarily mean full-blown celiac. Really, it's referring even to like gluten intolerance. I would say from an inflammatory and any sort of autoimmune standpoint, this is definitely something that we want to look at. Of course, when I start working with someone, I don't automatically tell them to stop eating gluten, but it is something that we talk about if we see this on your report. We look at alcohol metabolism, caffeine metabolism, and salt sensitivity. So interestingly, in the clinic, if anyone had high blood pressure, I told them that they needed to restrict salt. And it turns out that not everybody's blood pressure is affected by salt. So this is looking at specific genes. One of the genes is called an ACE gene. You may be familiar with some of the, like if you have high blood pressure, some of the ACE inhibitors are blood pressure medication. So we're looking specifically at those genes to see if salt is an issue. And if you don't have high blood pressure, sometimes salt sensitive patients are going to complain of like puffiness in their hands, or maybe their rings are tight after they eat more salt, that sort of thing. Then we look at weight management. So this gives me an indication what your weight loss resistance is. So this patient has low to moderate risk for obesity and weight loss resistance. We look at circadian rhythm, and really that has more to do with when will exercise best benefit you. Is it morning or evening? And sometimes people will come up that it's no preference. So this patient is more likely to be a morning person / get better benefit with less effort when exercising earlier in the day. And I love that we look at some eating behaviors because this is what people deal with. I mean, this is the meat of it as far as their willingness to eat vegetables, the enhanced sweet tooth gene, and kind of some strategies that we can use to combat that. And then we look at snacking and satiety as far as feeling full. So there are specific strategies for sweet tooth. That is someone that I want to really make sure they're not doing any sort of artificial sweetener, so sucralose or aspartame. Limiting the amount of sugar they're getting, that's sugar is a drug. So like if you've got this sweet tooth gene and you have a little bit, a lot of times you want more and more and have little self-control. Something else that comes up here, though, when I'm able to combine this DNAcore test with some of the real-time functional labs and look at gut bacteria, a lot of times we'll find bacteria in the gut that is what we call dysbiotic, that kind of is like screaming for the sugary foods to feed it. So some of it is genetic, but also I often see a lot of dysbiosis with that too. As far as, this patient, it wasn't a priority area, but the snacking and satiety, we really want to focus on scheduled meal times. So, a lot of times when people start diets, they try to eat so little that they're hungry often and never satiated. So making sure that you're actually having 3 full meals, balanced meals, protein, carb, fat, to cut down on some of the snacking in between is really helpful. And then we look at exercise requirements. I'm going to kind of just gloss through this a little bit. I get into this with each patient as far as what their requirements are, but it will tell us how many MET hours you need to mobilize fat stores and really help as far as joints and weight and all that sort of thing. It tells us your endurance and power potential, which I always think is cool. Muscle cramping susceptibility. Looks at how you recover from exercise. So this is going to have a lot to do with eating good foods, getting plenty of fruits and vegetables, and sleep, getting adequate sleep between your training sessions. We also look at risk for soft tissue injuries. So this is a gene that affects collagen and the body's ability to rebuild collagen, specifically after strenuous activity. And that's something that comes up a lot on reports. So I typically will put almost everybody on a collagen supplement. So then we get the summary. So for this patient, we want them to follow a Mediterranean diet. So some of the things that I'll see here are Mediterranean, low carb occasionally. Because this patient has enhanced benefit for weight loss when they're eating more polyunsaturated fats, this is someone who I would consider doing keto for a short period of time. That's never something that I want to leave someone on long, ongoing. And the way we do it in the South is typically wrong. But if we do a ketogenic diet with focus on those polyunsaturated fats, the PUFAs, this patient would likely have a really good response to that. And then I would move them to more of a balanced plan after that. So this goes through, and I just let everybody kind of read through this, but I want to show you some of the actual genetics. So this is what I find really cool. So this is the genotype results table. We look at the specific insight. These are the gene names, the variations that we're looking at, and then the genetic results. And you'll see here, this table at the top has is this no impact? Is it a beneficial impact, low, moderate, or high? So like I said, just because all those areas came up as far as priority areas doesn't mean that when I go through this report that I would consider those all high priority areas. So you can see lipid metabolism all looks pretty good, except this gene right here. This is the lipid oxidation, where that's coming from. I would want to make sure that this patient was eating lots of omega-3s. So the biggest thing with omega-3s is fish. If a patient does not like fish, I want to make sure they're on a good high quality omega-3 supplement. And if they can eat fish, we want to put that in rotation and make sure that it's wild caught. The content of fish from an omega-3, which is the anti-inflammatory fats, to the omega-6s, which are the inflammatory. When you eat farmed fish, you do not get the benefit of the omega-3s. So they've done several studies recently, and they're looking at the difference between farm raised versus wild caught, and you're only going to get that omega-3 benefit if you're eating wild caught. Just FYI. And then insulin sensitivity, you can see several moderate priority areas here. I know this patient and they were not significantly overweight, so this was not a high priority area for me. It's something that we use as information, want to focus on fiber and limiting the sweets and that sort of thing, but it was not something that I was super concerned about with this specific person. And then we have methylation. So this is MTHFR. I have this. I see a lot of people that turn up with it, as well as several other genes in this area. So you can see this person has a copy of the 677 and the 1298. So when we see one of both of these, that would be indicative of like having actual MTHFR. So I would want to make sure that this person is eating lots of spinach, lentils, eggs, and would definitely put them on a methylated B complex. And then this COMT gene, I wanted to point this out. This right here is responsible for the breakdown and detoxification of estrogen. So when we see a lot of estrogen dominant symptoms, like irritability before period, breast tenderness, that sort of thing, and even female cancers, breast cancer, ovarian cancer, uterine cancer, this COMT gene plays a significant role here. So this patient has a moderate priority, but I see a lot of women that I work with come back with it being a high priority. And again, if I'm able to do the functional labs to check these estrogen levels and the pathways with this, it really is incredible what we find and what we're able to do. So I wanted to mention that. And then this is the phase 1 detoxification. So the biggest thing here with detoxification is limiting the amount of toxins that are coming in. I always say this with a grain of salt because I don't want people to be so paranoid about the things that we're exposed to, but also be mindful. This is someone that I would say, okay, we really need to like not drink out of plastic water bottles, especially if they've, sat in the car and baked, at the beach or whatever. Choosing organic whenever you can and limiting pesticides, that sort of thing. This would all be very important for these genetics here. A lot of times also in phase 2, we'll see some deletions here. And anytime we have a deletion, that affects the body's ability to clean everything up and get rid of it. Remember that when our body releases toxins, it's through sweat, stool, and urine. So even combining things like constipation on top of this, that's something that we don't want all of that recirculating, especially if we have these genetic susceptibilities. So I've worked with several cancer patients, specifically like colon cancer, and I almost always find a deletion here in the phase 2 detoxification. And there are things that we can do to help that. I'll tell you about that in just a second. I want to show you the antioxidant enzymes. So this patient, this is definitely a high priority area. This is superoxide dismutase. The MN before it stands for manganese, which means that that pathway is triggered and relies on that nutrient to activate. And then this GPX is glutathione peroxidase, which is one of the most potent natural antioxidant enzymes that our body has. But when we see this genetic change, it does not function well. So this patient needs a lot of support neutralizing oxidative stress. The recommendation here would be to get at least 7 servings of fruits and vegetables, colorful fruits and vegetables a day, which is difficult for most people. So typically, if I see this on a genetic panel, I would put them on an antioxidant supplement. Oh, one thing I wanted to mention about this GPX, they have come out recently with several studies. Remember that the world of nutrigenetics is always evolving. They are studying more genes, they're doing more studies, finding links. I mean, it's really cool because it's always changing. But the GPX gene has really been associated with this TT allele change. Women who have this and take HRT, hormone replacement therapy, are at a lot higher risk of developing breast cancer. So they're doing more studies on it to really find like, what is the link there? But that's something that if I see this gene and the patient is taking HRT or considering it, it's just something that I want to make sure that we're doing everything else possible to potentially avoid that. Staying up to date on mammograms, that sort of thing. And then this inflammation panel, so all these ILs that you see here are interleukins. I describe it, it's like they magnify or upregulate the immune response. So this really this panel doesn't look that significant, but I see some that are all, or, several of them are high priority. So this would be someone who, you sprain your ankle and instead of it getting better in a couple weeks, it's like 6 weeks. So really focusing, going back to that omega-3s to support just that whole inflammatory pathway is very important. There's a lot of natural anti-inflammatories too, curcumin, turmeric, ginger, all that kind of stuff. This gets into all the vitamin D, vitamin A. I did want to show you, so looking at lactose intolerance. So just because it shows up as a priority area on the report in bold, I always look at these genes. So this is moderate. What I would typically tell a patient that I find this result is, if you're willing, let's do a trial without gluten for 4 to 6 weeks. See how you feel, and then you kind of do a cost benefit analysis. Is it worth it for me to remove it? Do I feel that different? I'd say one of the biggest things that I see here is not GI side effects, or, like you eat gluten and your stomach hurts. It would be skin rashes or skin psoriasis, any skin rash, and joint pain. Joint pain would be significant here as far as what gluten will affect. The way we produce gluten here in the States is very inflammatory. So like if I saw a high priority here and that inflammatory panel was a little bit more impressive than this patient's was, I would absolutely recommend doing a trial of no gluten. Remember though that with gluten, you have to completely eliminate it. It doesn't do any good just to cut back on it. You have to completely eliminate it. Okay, I think that is all. Oh, I know what I wanted to show you guys. Sorry, let me come back up here real quick. So in that lipid panel, this patient, it didn't come up, so it didn't catch my eye. This ApoE gene is really, there's a lot of research surrounding this gene because it has a lot to do with lipids in the brain as well, and associated with some neurodegenerative conditions like dementia, Parkinson's, things like that. This is one of my favorite tests to help me decide, like, let's say that I'm working with a patient who has high cholesterol and they're either on a statin or they've been told they need to start a statin and they don't really want to or don't know if they should. Of course, I'm never going to go against what your doctor's saying, but the E2 carriers are much more likely to respond positively to statin therapy versus the E3, E4. So that's something that I really like to look at, just in helping patients determine, okay, when do I need to, take medicine, and is that really reducing my risk? And this is one of the genes that we can look at with that. Okay, so I just want to scroll down here real quick. So after, it's going to go through on every report, it goes through every single area. It tells you what hypertriglyceridemia is. It tells you your result, it tells you the genes that it looked at, and then outcomes. It basically means like, what do you do about it? So this patient, we're just going to scroll past the lipid stuff. I want to show you, so lipid oxidation was on there, but I want to show you methylation. So it gives a really good description about what is methylation, what does it affect, why is it important, looks at your results, and then tells us right here. So this is why I only order this test when I'm working with a patient for a period of time. So my DNAcore program is 12 weeks. So we go through, okay, what foods do we want to focus on? Where can we add those in, and how to make it doable? Because I mean, I don't have time to saute spinach for dinner every night. So we really have to like make it fit with your life. But the recommendation here is to increase your intake of vitamin B, choline-rich foods, dark leafy green vegetables, lentils, whole grains, nuts, seeds, fish, eggs, and then consider supplementing with a vitamin B complex with the L5-methyl tetrahydrofolate. This all sounds like a really big word, but it just needs to already have that methyl part in there, because if you don't do that well, if that pathway is not working well, taking those vitamins is not going to help you. So I wanted to show you guys that one, and then the antioxidant enzymes, managing weight, exercise. Here's the 7 portions of different color fruits and vegetables. selenium-rich foods like Brazil nuts, but remember that Brazil nuts have incredible selenium if they're grown in Brazil where the soil has high selenium content. So sometimes getting them from like Costco, we don't really know where they were grown and what the soil content is. So if you can ever get Brazil nuts from Brazil, that's going to give you the best bang for your buck. And then consider antioxidant supplementation, which is kind of what I mentioned that I usually do because it is hard for patients to get that many servings of fruits and vegetables in a day, but we work on it. And then detoxification, I wanted to show you decreasing the load on phase 1 by reducing exposure to environmental chemicals, pro-carcinogens, so cigarette smoke, smoked and char grilled foods. A lot of people are like, oh, grilled is automatically good. But if you are, have these accelerated phase 1 enzymes, one of the things I tell patients to do is to cook. If you are grilling, always cook with rosemary. So you can put some fresh rosemary on there. It really helps absorb, neutralize the toxins. And then spices, the curcumin, turmeric, that sort of thing. So I like that it tells us, what it is, what genes we're looking at, and then what to do about it. I think that's all I wanted. So it goes through everything. I mean, like I said, it's 62 pages, so you can look through everything. It goes through, it tells you how to calculate MET hours as far as exercise. It's very detailed, very thorough. It's one of my favorite tests, just, as I have gotten into the functional world. So yes. Okay. Let me go back to my presentation. I stopped sharing my screen, didn't I? Okay. Does anyone have any questions about anything so far? Okay. All right, I'm back. Hold on. Okay, we're back. All right, so that is DNAcore. That is a very abbreviated version. It takes me 45 minutes to an hour to go through this with patients, and like I said, we usually revisit it several times. All right, so let's talk about, I'm always like, okay, well, what does this mean? And like, what does this look like as far as your program? So like I mentioned, a lot of people have reached out about, can I just order this test? But there's no significant point in you having these results if we aren't going to do something about it. And that takes time to work through. So whatever your goal is, whether it's weight loss or fatigue or hormones or, cancer history, risk, concern, we work through that together for a period of time. So I have several different packages to accommodate different budgets. DNAcore and nutrition consulting. So we do an initial virtual visit. I have a clinical platform that is HIPAA compliant. I give you a personalized nutrition plan, which means I give you a goal as far as how much protein, carbs, fat I want you getting. I break it down really simply. So we start with protein, then we add the carbs and the fat. I review your food log. I have an app that will pair with your food log. So if you at least track your food once or twice a week, you don't have to do it every single day. I'm able to review that and I can give you pointers on, okay, hey, let's add this here. This is a way to get your protein higher. And so we work really closely one-on-one. That's why my clients get amazing results. I have weekly Q&A sessions on Zoom. Everyone can pop in, ask questions. I post the recordings if it's not a good time that week. Lots of accountability, encouragement. I have tons of recipes, meal plans. We do a follow-up phone call at week 6 and 12. What I usually will do is I give you a nutrition plan to start working through as we order DNAcore. That test kit is mailed to your house. It's a finger prick, so you don't have to go to the lab. You do a finger prick, you drop it on the little blood spot paper, mail it back, and I typically have the results within 3 weeks. We sit down and go through that, and then we are able to narrow in even more nutrition-wise. Okay, do we need to get more fats? Do we need to think about limiting the carbs more? What specific fruits and vegetables do we need to add based on the inflammation, detoxification, methylation? And so we're able to narrow it in even more. It takes a lot of the guesswork out. And then I give you supplement recommendations tailored to your genetic makeup so that you're not spending money on random things that may or may not be working for you. So that is DNA Core and Nutrition, and that is a 12-week program. So we work together for at least 12 weeks in that capacity. And then with functional medicine, so this is the most comprehensive tier package that I have. We do DNA core, so we look at the genetics, but we also look at a lot of the real-time labs. So we look at hormones when it's appropriate. We look at thyroid, we look at cortisol, not just a cortisol level. I track it throughout the day. I do a complete gut health evaluation. I am so passionate about gut health and how most chronic disease is originating in the gut. Food sensitivity testing if GI complaints are something that you have. So it's very thorough, very comprehensive. We do nutrition, but it's also a lot of lifestyle, stress management, sleep, that sort of thing. A lot of people want to upload their medical records and have me look through past labs and things like that. So I will do that. I'm not looking at it and giving you medical advice, but I'm happy to look at it and sort of kind of give you my opinion. We do one-on-one virtual appointments at least every month, sometimes more often than that. You have 24/7 access to me. And of course, you have a lifetime access to all of my meal plans and that sort of thing with that program. And that program is 16 weeks. So it's more in depth. It takes more time to get some of these tests back. So we really do have to work together for a little bit longer. So DNA Core would be ideal for you if you're tired of guessing, you're tired of trying to do it on your own. Maybe you are tired of wasting time, spending a lot of money, trying random things, random supplements that haven't worked. If you want something that's really personalized, I mean, if you haven't tried Weight Watchers and you want to try Weight Watchers, like that is not what this is. So this is something that's very specific to you, to your genetic makeup. You're working one-on-one with me. And obviously the goal is to set you up for optimal health. So some people ask, is this something that I would do if I don't have a lot of weight to lose? I work with a lot of women who don't have a lot of weight to lose, but really just want to set themselves up for optimal health. And everybody wants to know cost. So let's talk about cost. I rarely do sales. The last sale I did was Black Friday, because quite frankly, like I don't need to. I told Ashley before I started this, I'm like, I'm not sure. I mean, I want to offer you guys an incentive because you're here and you're listening. But I only have a few spots. So for DNA Core, the regular price for everybody is $850 a month for the 12-week program. So I'm doing a 10% discount, and it would be $765 a month for the 12-week program. If you want to step it up and do the full functional medicine consulting, typically that's at $1,800 a month for the 16 weeks. And if you sign up in the next, so it's only going to be for 48 hours.